Good afternoon. Let's take a look at Chapter 17 in Butera, that information, along with some supplemental information that I might add related to routine health screenings. Achieving and maintaining optimum health for each individual patient is the goal of high-quality primary care. Primary disease prevention and health promotion are critical elements of comprehensive health care that must be addressed by primary care providers. So, health screenings and immunizations, along with health risk assessment and education about a healthy lifestyle, form the cornerstone for primary prevention and health promotion activities in primary care. Each visit with a patient provides you with the opportunity to offer an appropriate health screening and to ensure that the individual's immunization status meets age recommended guidelines. So, how do we determine which health screenings are considered routine? Well, that really varies between the agency making the recommendation and the individual or the patient's healthcare insurer. One of the most important ways is that the U.S. government agencies publish guidelines for overall health promotion and disease prevention that include specific health screenings. But what's confusing, especially when you're a new provider, is that there are variations between the agency's recommendations. But one thing that we do know that they are evidence-based and they're based on comparative effective parameters. So these are recommendations that you should evaluate what may be appropriate for the individual patient based on your patient's history, personal medical history, family history, and individual concerns. So when you find these variations between agencies, it will be ultimately, you'll decide which ones to apply. And I think you'll be quite surprised at how sometimes the variations are extreme. So it would have to be that they are looking at new research or different data, since they're all basing their recommendations on evidence. Two of the agencies that are available to clinicians and address overall health evaluation and screening are through the U.S. Department of Health and Human Services, and they have specific recommendations about for all adults that's inclusive of every age, that they recommend that each adult should be screened for height and weight, skin exam for moles or lesions, heart health, bone health, diabetes, breast health, reproductive health, colon and rectal health, eye and ear health, and oral health. I want to direct you to Table 17.1 and 2. There's also an agency that is non-governmental. It's supported by our government. It's called the U.S. Preventive Services Task Force. And this is a panel of non-government primary care providers and health behavior providers that are considered to be experts in health promotion and disease prevention and in the evaluation of evidence health research. So they are a big part of the information and guidelines that a lot of clinicians use. So not only do we have guidelines that can direct our care and from agencies, but we also have tools for health risk, and we kind of use those in concert. There's actually multiple tools to assess an individual's lifetime risk for certain diseases. So these tools are used in adjunct, again, to help make screening decisions, and they indicate whether that individual is at high, medium, or low risk for the condition, and then you can base some diagnostic decisions on that rating. A few that I want to point out are the AHRQ's Electronic Preventative Service Selector. It's a quick, hands-on tool designed to help primary care clinicians and healthcare teams identify, prioritize, and offer screening, counseling, and preventive medicine services that are appropriate for patients. The next one is In the United States, for heart disease, clinicians use the Framingham Risk Score, and currently the Framingham Risk Score uses age, gender, total and high density lipoprotein (HDL), cholesterol, smoking history, systolic blood pressure, and use of medications for hypertension to calculate a 10-year risk for coronary artery disease. The next tools that can be used for health risk is through the National Heart, Lungs, and Blood Institute. It's an expert panel that published updated guidelines on cholesterol, hypertension, and obesity. And then the last tool I'm going to mention is the breast cancer risk assessment tool, and it's based on statistical Gale model and was developed for use by health professionals by experts at the U.S. National Cancer Institute. I believe the reason why Butera prioritizes cancer screening specifically and directs us to some information and some guidelines is because cancer is the second leading cause of death in the United States. So I think that statistic is quite alarming and should heighten our screening and guideline use. So one thing that we have available to us in Table 17.4 is to compare the American Cancer Association and the U.S. PSTF recommendations for cancer screening. And I'd like you to take time to look at the differences. Genetic testing for cancer risk is recommended for patients with several first-degree relatives with the same type of cancer, and we have some really good and sensitive and specific tests for breast, ovarian, pancreatic cancer. So the other part that is included in our readings is about preventable cancers. There's actually two categories, and they're broken down into specific lifetime factors and associated with infectious agents. So we know that tobacco, obesity, inactivity, poor nutrition, and excessive alcohol use are not good for us and are not healthy, but they actually are carcinogenic. And so by eliminating alcohol, tobacco use, incorporating regular exercise, and following healthy eating habits, we really can reduce the occurrences of some cancers in our patients. Interestingly enough, the infectious agents that we know we can impact as providers, primary care providers, are hepatitis B, human papillomavirus, HPV, and Helicobacter pylori. So these can be treated either through vaccine for prevention, Hep B and HPV, or antibiotics like with Helicobacter pylori, and it can eliminate the occurrences of certain cancers, whether that would be for Hep B, liver, HPV, cervical or penile or anal, or H. pylori, esophageal or stomach or intestinal cancer. Finally, in this section, we're just going to touch briefly on screening for coronary artery disease and tuberculosis. And, you know, the next section in our Butera is really about immunizations, but I'm going to break that apart because it's so lengthy and it's so important. So as we consider coronary artery disease, we know that's the #1 killer of adults in the United States. And so the American Cardiac Association has guidelines for screening for coronary artery disease in all adults, and they recommend using a tool such as the Framingham tool. And that tool is interesting. It bases that screening on several different components. And I want you to refer to that screening tool so that you can look at what they use within the Framingham tool. As far as screening for tuberculosis, as nurses, we're all familiar with that. It's recommended for asymptomatic individuals for whom new infection is suspected, individuals who have close contacts with patients with active TB, those who inject street drugs, patients who are from countries where TB is common, such as Soviet republics, Latin America, Caribbean, Africa, Asia, Eastern Europe, and those who spend time in settings where active TB is common, and unfortunately that's the nursing home, migrant camps, or institutional settings. And so this is a very brief snapshot, but this is a big part of what we do as advanced practice nurses. Thank you for your attention.